Go.
Okay, so this is going to be the secondary survey video. And for the secondary survey, the first thing we're going to want is to get the sample from the patient, and the sample is basically the patient's history. The first thing I'm going to want to start with is signs and symptoms. But if I was walking up to a patient, I don't want to sound so robotic doing it. So first I would ask, so how come you called us here today?
Oh, I'm coming in for my arm.
Your arm?
I heard it. I fell off the bike.
You fell off your bike? Okay. Any bleeding on your arm?
No bleeding. This
right?
is just a little bit of scrape.
Does it hurt?
Really sore, yeah.
Yeah. Is it a sharp pain, dull pain?
It's more of adult pain.
Any difficulties breathing?
Yeah.
Anything like that? Okay. Next thing I would want to move on to is her allergies, and ask the patient if they have any allergies. Do you have any allergies that we should be aware of or know about?
Just seasonal allergies.
Seasonal allergies? Okay. And then any medications that you take that we should know about?
No medication.
Sounds good. Any under your healthcare provider, are there any conditions or illnesses that we should know about when treating you today?
No, just my arm. I'm just coming in
Okay.
for my arm.
Have you been recently hospitalized anytime recently?
No.
Sounds good. And the next thing we want to do is get the last oral intake for the patient. And have you? When was the last time you ate or had any medications?
I took some Advil about maybe 6 hours ago,
Sounds good.
and I haven't had a DPE since breakfast.
Sounds good. And can you tell me? Do you remember falling off your bike?
Yes.
Okay. Do you remember the? What's the pain that you had, instant and severe, when falling off your bike in your arm?
Just a little bit. I didn't really start to feel it until I got up and started moving.
Yeah. And then, do you remember what you were doing before you went on your bike ride as well?
No, I don't. What do you mean?
Well, I mean, I'm making sure that the patient's still cognitively there, just to make sure they don't have any concussions for any, I'm just checking for signs and symptoms of concussions and make sure that nothing's there in their memories there. That's why I was asking if you were doing anything before the bike ride. See if you can remember it.
Nothing really. Just got up, had breakfast.
Yeah, okay. Sounds good. Now, after doing that part of the secondary survey, I would want to move on to the dots, look for any deformities, open injuries, tenderness, and swelling, and then I want to do a head-to-toe assessment. So with the head-to-toe assessment is I would want to let the patient know, okay, so I want to move on to the head-to-toe assessment for you to make sure you don't have any other injuries when you fell off your bike. The first thing I would want to start with is the head and neck. One thing I need to do for this is to check the pupils and see how they react to light. So after that, the first thing I would want to check is the neck and head and check to see if palpitating, see if there's any pain. So I'm going to go ahead and check your head for any pain. Any pain? Any pain?
No.
Okay. Any pain?
No.
Any pain?
Yes.
Yeah?
Yeah.
In your shoulder area? Okay.
Yes.
Go ahead and look to your left for me. Any pain?
Just a little bit.
Okay, look to your right. Any pain for me?
Yes.
Yes? Okay. And then after doing the head, and after knowing that there's some injuries in her shoulder, probably from the impact of falling off her bike, I want to be careful when I'm palpating the rest of that area. Next thing I'm going to want to move on to is I'm also going to want to check their ears, check and see if there's any leaking or fluids in there. And then after that, I'm going to want to move on to the chest and shoulders. I'm going to want to look for a deviation in trachea, which would indicate a punctured lung. I'm also going to want to have the patient breathe in and out as I squeeze the rib cage to make and check for any pain or crepitus there. So, any pain here?
My right shoulder.
The right shoulder. Any pain here?
Just the right side.
Okay. I'm going to have you go ahead and breathe in for me and hold it in, and I'm going to squeeze your rib cage to check for any injury. So, breathe in and hold it for me. Any pain in your rib cage at all? Okay. After that, I'm going to want to move on and check their abdominal area. I'm going to palpate the 4 quadrants to check for any injuries here. So, any pain here in your abdomen? No. Any pain here?
No.
How about down here?
No.
Or down here? No. Okay, cool. And then after checking their abdomen, I'm going to want to check their pelvis and see if they have any injuries in their pelvis. I'm going to check the size of the pelvis. I'm also going to look for any incontinuities. So any pain here
No.
in your pelvis?
Just a little bit. No.
Just a little bit right here? Okay. Any pain here?
No.
No? Okay. After checking the pelvis, I'm going to want to move on and check the legs and the feet. So go ahead and just sit down for me and kick your right leg out. You don't have to do it anymore if it hurts you, but kick your right leg out and move your ankle around. Any pain there?
No.
Go ahead and rotate it the other way now. Any pain now?
No.
Now, can you go ahead and do the same thing for me on the left leg?
No.
And now rotate the other way. No. And then the last thing I would want to check for is, especially if there's a leg injury, I want to check for the capillary refill of the toes. So I would go and check her toe and check for a capillary refill and make sure like the blood's going back there perfectly. And then that would and then I'm also going to want to move on to the arms and legs. I'm going to check for capillary refills if the arm is injured. And then also check if both legs feel the same sensor. What? Oh, like that. Okay, so any pain here? No? Any pain here? No? May I see your hand, please check the circulation. Thank you. And then any pain here?
Yes.
Yes? How about here?
Yes.
Here?
Yes.
Yes? And then how about your hand?
Yes.
Okay, and let me check for capillary circulation again. Okay. And after checking her arms and hands, I want to check the patient's back by rolling them on their side. So go ahead and you can just lay down right here. So I would roll the patient on their side. And then make sure to bend your knees, please. And I would check and palpitate their back and check for any kind of pain. So any pain here?
Yes.
A little bit. Any pain here? Pain here? Pain here? Pain here? And pain here? Sounds good. And then based on that, the secondary survey, I would go ahead and move on to treating the patient's injuries. I would probably start with the patient's arm since that's where the most pain and discomfort is coming from.